Hello, I'm Dr. Stephen Myers, and today I want to talk about working with street people. I worked with street people for over 10 years, and I want to share some of my experiences working with them that can hopefully help you better and understand them better. And I looked at one thing is that there's a lot of mental illness among street people. And some think, especially Christians, fundamentalist Christians, that mental illness is just sin, that you just need to confess your sin and get rid of the mental illness. Or it's a judgment from God, or you have to cast the demons out so you won't have this mental illness. But I don't think that's the proper way to look at it. There's medical reasons for a mental illness, and we want to touch on some of these today. Here's a chart talking about the homeless and mental illness. Among the regular population, about 5.6% of general adults may have some form of mental illness. Whereas the homeless, it may be 22% severe. If you count all mental illness, it could be up to 67% on how you look at it. So it is a problem. There are several key mental illnesses, and we'll look at them one at a time here. Schizophrenia, it's the chronic condition involving psychosis, which is you're having hallucinations or delusions, hearing voices, disorganized thinking, and functional impairment. And the evidence, you have base treatment for this is antipsychotic medication. There's just something going wrong in the brain. It's not sin. It's something you can see on an MRI, or things going wrong there in the brain. And medicine helps out. But that's just one way of helping out. You can have supportive housing and other counseling, and to prevent relapse. And some, what they do is there's good medicine to help them, but it makes them feel drowsy and not that well. So they'll get rid of their medicine, not take their medicine. And what they do instead is they may take like heroin or cocaine or something that makes them feel better, but doesn't help their condition. Common risk factors, there's a genetic vulnerability. There's a genetic history, genes involved, early trauma. So all these, the neural development of the brain, sleep deprivation, and other things, common risk factors and factor into mental illness, especially here we have for schizophrenia. Now, I had a good helper at, I started the Kensington Bible Church and Outreach Center, and people that came were street people. And I had a good helper here, but he was paranoid that people were trying to poison him or kill him. He was a paranoid schizophrenic, and he would think that the milk, somebody put something in the milk. No, it's sealed, but he thinks somebody must have poisoned it, or somebody's climbing up through the walls to get him. And when he moved to another place, in his room he had all sorts of gadgets and alarms to try to prevent people from trying to poison him or hurt him. And so he had all these gadgets he put together. He was very smart and could function well, but he had these delusions that people were trying to poison him. There's another guy I talked to that one time he thought that the TV was could see him and was looking at him, and whereas today people don't normally think that. Of course, with different cameras and things, you never know. But he thought the TV there was looking at him and could see what he was doing. And also the CIA was after him. Or somebody might think the air conditioner making that noise is the CIA trying to follow him. Another guy, he said he saw an angel. I'm not sure if he heard voices from the angel or not, but normal people don't see angels. So he was having delusions about seeing an angel. And hearing voices is very common, that you think the voice in your head is actually the wiring in the brain is wrong, so you think it's coming from an outside source, and many think it's God that is talking to them. And the most famous is the son of Sam, who thought God was telling him to kill prostitutes. So we have to be very careful hearing voices. That's a key sign of schizophrenia. And medicine, modern day medicine, can help that out. Another disorder is bipolar disorder, a mood disorder with episodes of mania or hypomania and depression, and it can severely disrupt the way you function in life. There's mood swings from getting very high and excited to very depressed. And some may stay more on the depressed side, and some will stay for a number of days in mania, hypomania. And there is medicine, mood stabilizers, so you don't swing back and forth, but sort of stabilize you, keeps you in the middle. Lithium is one key drug for that, and they have newer ones today. I studied it a number of years ago. And there are new medicines that can help you out, but there's also those side effects that some people don't like, so they don't want to take them. It has a strong genetic component that if someone in your family has it, you may have a chance to inherit that. And the core symptoms to recognize mania: decreased need for sleep, racing thoughts, risky behavior, and other mood swing to depression, anhedonia. It means no hedonism or no pleasure in things, and suicidal risk. And my son has put together a video talking about this. This is a YouTube video that my son put together. It's called A Fractured Mind and Unfailing Grace. And it follows Alex's journey through challenges of bipolar disorder, finding hope and faith, therapy, and community. A story of struggle, grace, and redemption. I'll put a link below so you can watch that to get an idea of how a bipolar person thinks and feels. Another disorder is the major depressive disorder. Persistent depressive mood or loss of interest with cognitive and physical changes that impair daily life, lasting over 2 weeks. So an extended period, because we all have ups and downs in life. We're feeling a little depressed, a little low uh, for a day or two or something. Uh, but this continually lasts for 2 weeks or even more extended periods of time. This could be caused by trauma, chronic stress, medical illness, grief, isolation, substance use, poverty, stressors. And there are a number of good antidepressants that can help you not feel so low and sort of steady you out. And there's also trauma-informed care, social support, housing that can help out. So it's a multifaceted way of trying to help out. The core symptoms, you have mood, no pleasure, fatigue, sleep problems, appetite changes, poor concentration, hopelessness, suicidal thoughts. And if you do have suicidal thoughts, you can get help. It's free, confidential crisis support 24/7. You can call or text or chat at 988. I remember I had an operation, and when I came out, I was in real pain. And so they gave me Percocets to take. And that stopped the pain, but it left my head hurting or buzzing, and I didn't like that part. So I stopped taking it, and I started having suicidal thoughts because the Percocets is very powerful medicine. You should slowly go off it. I just stopped it altogether because I didn't like what was going on, but it did kill the pain. And I had suicidal thoughts for a couple of days, but then finally it went away. But it can be a terrible experience thinking bad thoughts and wishing the world would end and life would be over with. But there is a medicine that can help with that. PTSD stands for post-traumatic stress disorder. And a lot of times this happens with the veterans coming back from a war and the terrible horrors of that. It's trauma-related disorder involving intrusive memories, avoidance, negative mood, cognitive changes, and hyperarousal. And this can result from triggers exposure to violence, assault, repeated trauma, childhood adversity, and an ongoing unsafe environment. And there's, especially if you're depressed, to take medicine for depression. Trauma-focused therapy helps, and stabilization housing. Things like that. And the symptoms, you have flashbacks, nightmares about this, especially if you're a war veteran. Hypervigilance, you got to look out so something may not happen to you. Irritability, avoidance, dissociation, and sleep disruption. But there can be some medicine to help out, and specializing counseling. And combining all these things together can really help out. Substance abuse is another one, and this is a lot that happens in the street. You may have some other mental illness or disorder, and you use a cocaine or heroin or other substance to try to make you feel better because of these disorders. And it's a chronic condition where repeated substance use leads to a loss of control, craving, and continual use despite a harm to oneself. And this could be caused by trauma, other mental illness, social exposure, pain, stress, homelessness, and there is medication that can be taken to help you get off certain drugs, as well as you need therapies, peer support, housing, a number of things that work together that can help out. Of course, symptoms, craving, withdrawal, tolerance, risky use, functional decline, relapse cycles. You want to quit. You may come forward and get saved, but then you fall back and you have to get saved again, or you have to get the devil cast out of you again. And you go through these cycles. But the key thing is getting back up. You may fall back, but get back up again. And there's people and medicine that can help you out. I'll go more into detail, especially drug addiction, in another video. Here we have a summary of causes, evidence, not sin or demons or things like that, or God punishing you, but there's genetic part to it, vulnerability, dopamine deregulation, that the mind isn't functioning right. Early trauma can affect this, and substance triggers. And antipsychotic drugs can be very helpful, but there's always side effects, and you have to still endure some of that. And they're always making and discovering new drugs with less side effects. Then bipolar disorder also has a very strong genetic component in the family history. The brain chemistry is unstable. You have sleep disruption, stress, and the treatment, mood stabilizers like lithium, and they have some more modern ones that can even be more helpful. Then major depressive disorder, that's a genetic risk as well, trauma, chronic stress, medical illness, isolation, all things that can keep you down. And there's some good antidepressants for that, as well as you can have therapy helps out as well. And then we have PTSD, post-traumatic stress disorder, which is an exposure to severe trauma, violence, abuse, chronic distress. And there's therapy for that, and antidepressants can help out, as well as having a stable support and housing. And then substance abuse causes trauma, genetic vulnerability, environmental exposure, mental illness, and I'll go into detail more in another video about that. Now, an integrated care pathway works the best, where you have a number of things coming together, like you have stable house situations so they're not in the street, mental health treatment, drugs that may help you out, medical care and benefits, people supporting you. Can have a big effect where you have all these different factors coming together. And we have safety, stabilized sleep, starting the medication, support housing, long-term relapse prevention. And if you fall, get back up again. And some of the pitfalls of homelessness is not caused by mental illness. Treating substance use as a moral failure, as sin. You just have to have faith, and you don't have enough faith. ignoring trauma and sleep deprivation, and having the right housing and care plan. Here's a summary of mental illness, mental disorders, the theological versus the medical. Where the theological, it's sin, or God is punishing you and you're suffering, or this is to make you better suffering, or demons are after you and causing this. When it's in reality, it's a multi-factor brain biology. Your brain isn't working right. The genetics involved, trauma, stress, and environmental pressures, and sometimes medical factors as well. And some thing it's going down the line there, you have the moral responsibility, thinking theologically it's a sin when it's not moral failure, and other things you can see there. That most important is getting a holistic approach of a number of things coming together to help out the person. So in conclusion, mental illness is not caused by sin or Satan and his demons, nor is it punishment by God, but it's multi-factors involved with your brain not working right, brain biology, genetics, past history there, trauma, stress, the environment, if you're in a poor environment and everyone's doing drugs or something, and there's lots of stress, it can lead to abusing other substances, cocaine, heroin, and other things. Or I guess the main one today now is fentanyl. Then you have the cure is multifaceted. You need medication when appropriate, counseling, psychotherapy, trauma and informed care, crisis support, housing, stability, all these things coming together to help out, and not just one thing by itself. And the website is BibleandScience.com. I have a link below, and have some other links that you can click on, and information. And I want to thank you for watching the video. If you like it, make sure to like it and subscribe. And we'll look forward to another video, especially on dealing with drug addicts. Thank you.